Ohio. We're high on Ohio. These stories inform and inspire through the words of people who make Ohio home. Good news and good ideas, identifying and acknowledging the excellence that is all around us.
You know, the best response to hunger and poverty is a good job that pays a livable wage, that provides health care with time off and an opportunity to work towards some type of retirement savings. And that's what we need to focus on. You know, food stamps are a work support program just as Medicaid. And when those good paying, middle-income jobs have disappeared, what we've replaced them with is part-time, low-wage, contingent work. And people need benefits such as the food stamp program or Medicaid at which to supplement those inadequate jobs.
So if I hear you correctly, you would allow it to, so you could buy Tide, but on the nutrition side, how would you handle, I mean, people, I mean, my wife and I doubt if we buy a dozen 2-liter jugs of soda pop in a year, mostly for entertaining. How do we, balance all that so that obesity is a huge problem, especially in the working poor, which then leads to diabetes in many cases, which is a huge medical complicator, and it really drives up the cost of Medicaid overall. And to also clarify, I think the number is something like 5% of our Medicaid recipients use like 90% of our Medicaid dollars or something like that now. So it's not the folks on welfare that are driving this stuff up. It's some very highly, fragile people out there that we're having to take care of. How do we fix this? Have you ever drafted ideal legislation on this?
That's a great question. I think what we need to do is step back and look again. The benefits are woefully inadequate. It assumes that individuals have 30% of their income which to supplement their food stamp benefits, which they don't. Certainly with rapidly rising housing, utility, and transportation cost, their paychecks aren't stretching. So increasing the benefit level would allow folks to make healthier choices. An example that you use is the 2-liter bottle of pop that you can probably purchase for about 79 cents. Yeah. A gallon of milk is $3.79. And I will tell you, one of the things that I have witnessed over the decades, when low-income families don't have the resources to purchase, whether it's milk or infant formula, oftentimes, as they did way back when, they pour pop in those bottles to satisfy the child, just as our parents or grandparents may have done, which is put sugar water in the bottles. What we need to do is reinstitute as a mandatory program in education settings, starting literally with elementary to high school, is nutrition education training. That has been removed as, quote, extracurricular and not necessary to core educational goals. So again, as soon as kids get into school, pre-K, we start teaching them about proper nutrition and eating and the health impacts. We reinstitute physical education in our education settings along with financial literacy.
And I would think that people on the right and and the left would agree we need to be better nutrition for people as a helpful tool in all this. It just has a whole lot, yet we're having difficulty having traction.
Yeah, and what we see, I mean, we're in the hunger field. It's no different than in the general public. In literally 2 generations, people have become completely disconnected with where their food comes from, and that is having all of these health consequences that we have with diabetes, hypertension, renal failure. And again, these are, diet-related diseases. So it's connecting people to where their food comes from, as I say. It doesn't...
Community gardens?
Community gardens, but more importantly, that what we eat doesn't have to be always fried. It doesn't necessarily come out of the frozen food section as prepared, but it comes from a farm. It could be processed, but again, moving folks back to where their food comes from. Food is medicine, food is health.
Yeah.
And that is the piece that's really missing from this as we debate the options that are before us as a state with Medicaid expansion, and our association advocates a clean Medicaid expansion to allow individuals, many who work every day, but don't work for employers that provide affordable or even provide health care coverage, that we need to get them attached to a health care home, treatment for chronic diseases, and on a path to wellness. And as you said, the major drivers right now, we pay a horribly high cost of hunger in this state. In fact, the cost of hunger in our state is about $6.9 billion a year. And almost 80% of that is directed at the healthcare cost associated with what you said.
Okay.
Diet-related diseases, diabetes, hypertension, chronic diseases that can be prevented with proper nutrition.